Hello and welcome. Today, I want to talk to you about something that many people struggle with, symptoms of generalized anxiety and worry disorder, or GAD. If you find yourself constantly worrying about a variety of things, feeling on edge or unable to relax, you're not alone. Anxiety can feel overwhelming, but the good news is that there are effective treatments, such as CBT, that can help. In this video, I'll explain the symptoms of generalized anxiety, the role of worry and uncertainty, and how CBT can help you regain control and start feeling better. Generalized anxiety disorder, or GAD, is characterized by excessive and uncontrollable worry. It's not just about being concerned over something specific. With generalized anxiety, the worry is constant and it often doesn't have a clear topic or focus. When people experience generalized anxiety, they often notice persistent and excessive worry about a variety of things, even when there's no clear reason to be concerned. They might notice they have difficulty controlling that worry or even finding relief. You might even feel restless or on edge, often with some physical symptoms like muscle tension, headaches, or fatigue. You might have difficulty concentrating or feeling like your mind is going blank because of all the anxious thoughts you're having. You might experience sleep problems such as trouble falling asleep, staying asleep, or having restless and disturbed sleep. If this sounds familiar to you, it's important to understand that anxiety isn't something you can just turn off. It's a real condition that affects your mind and body and can leave you feeling trapped in a cycle of worry and stress. One of the key features of generalized anxiety is uncertainty, the constant fear of what might happen in the future. This sense of uncertainty can create a lot of tension and leave you feeling paralyzed as if you're bracing for something bad to happen at any time. In fact, with generalized anxiety symptoms, it's common to imagine the worst-case scenario over and over, even when the situation doesn't warrant that level of concern. This type of thinking, called catastrophizing, can make you feel anxious and overwhelmed, even though the worst outcome is unlikely to happen. So, how can Cognitive Behavioural Therapy, or CBT, help with anxiety and worry? CBT is a highly effective, evidence-based treatment for anxiety. The goal of CBT is to help you break the cycle of worry by changing how you think about anxiety-provoking situations and learning to manage the physical and emotional symptoms of anxiety. The first step in CBT is learning to identify and challenge your anxious thoughts. When you're constantly worrying, it's easy to start believing that those worries are true. In CBT, we work together to examine those thoughts and ask questions like, is there any real evidence to support this worry? Or, what's the worst thing that could happen? How likely is it to happen? For example, if you're worried about an upcoming work presentation and you think, I'm going to fail and embarrass myself, we'd explore that thought. Is it true that you'll fail? What evidence do you have that you might succeed? We'd work to replace that thought with something more balanced, like, I'm prepared and I've handled situations like this before. By challenging these unhelpful thoughts, you start to reduce the power that they have over you, which helps to reduce the anxiety that you feel. The more you practice this, the easier it becomes to change your thought patterns and decrease the amount of worry. Another core aspect of CBT for anxiety is learning to tolerate the unknown or uncertainty. People with generalized anxiety symptoms often feel the need to be 100% certain about everything before they feel comfortable. But as we know, life is full of uncertainty, and trying to control every outcome is exhausting and impossible. Over time, CBT helps you develop the skills to manage anxiety on your own. It's not about eliminating all worry. That's unrealistic. Rather, CBT teaches you how to keep anxiety in check and prevent it from taking over your life. With practice, you can build resilience and reduce the intensity of your worries, helping you live with greater peace of mind. If you're struggling with anxiety or constant worry, please know that you don't have to face it alone. CBT can provide you with the tools you need to break the cycle of worry and uncertainty. It can help you feel more grounded, more in control, and more confident in managing life's challenges. Here at Ontario Structured Psychotherapy Central North, we offer government-funded, structured CBT in both self-guided and therapist-led formats. Visit our website to make a self-referral at www.therapyontario.ca.